Good morning, everybody, friends, colleagues. I'm delighted to be with you for this conference at Chad in Staffordshire University. I'm sorry I can't be with you in person, but at the time I deliver this lecture, I'll be on an operating table. And that in itself is one of the things that went well in the pandemic. When we think about the digital revolution, it's been propelled forward greatly by the pandemic, enabling us to meet virtually in this way and potentially saving quite a lot of carbon footprint for the environment. As Mike Berners-Lee described in his book, How Bad Are Bananas, a Zoom call is a very environmentally friendly way of doing business. However, to say that this was a major upside of the pandemic would be a gross disservice to all the people who've died. It would be like saying that the Second World War gave us the biro. So what did go well globally in COVID-19? Well, I mentioned the digital revolution. Some of the data presentations, some of the real-time stuff that we've been able to use has been a revelation, and there's been a range of people doing clever presentations, and we're all epidemiologists now, aren't we? Early on in the pandemic, there were decisive actions, as we know from many of the East Asian countries, Australia and New Zealand, applying their knowledge and what they knew from SARS-1 and MERS and not making the same mistakes. There were also decisive actions by some other nations, the COVID underdogs, in accordance with World Health Organization guidance issued in January 2020. Simply wasn't true to say that we didn't know what we could do. And there were scientific and technological advances in vaccines, health services responses in many countries, particularly where there was universal health care, were admirable. And the mutual aid that many communities managed to put together has been a major and lasting benefit. The initial ambition for COVAX, the international vaccine distribution, was both admirable and desirable, as we'll talk about later. So what of the COVID pandemic then? Well, we're approaching 5 million recognised deaths from COVID-19 and 200 million cases or more, and considerable underreporting in those figures. But there have also been what are described as syndemics. We've seen years of underinvestment in public health services and also underinvestment in the policies that keep people healthy. And that has led to austerity killing in large numbers ahead of the pandemic. So we'd set the conditions in UK and much of Northern Europe for this pandemic to be much worse than it needed to be. And that was very much the seeds of the disastrous performance we've seen in Europe. We've seen the pandemic disproportionately kill more people from minorities, particularly black men. We've seen it damage the lives of hundreds of thousands of people who were not killed by it, but it's impacted unequally, particularly in terms of mental health, but also in terms of domestic violence, and these have been described then as the syndemics. Back in November last year, I described what I called the three faces of COVID, and those three faces were the countries that did well from the start of the pandemic, the East Asian countries, New Zealand, Australia at the time, but there were also what came to be known as the COVID underdogs. These were countries that did what the WHO said they should do as early as January, They shut down early. They mounted screening and testing, controlling the virus, and they closed their borders. Amongst these lesser known country experiences, Uruguay, Japan, Trinidad, Ghana, Rwanda, Sri Lanka, Vietnam, all of these countries acted swiftly and did very well, particularly in the first wave. But there were also countries like, and there they are, the Mongolian response in the early phases. But countries in Central Europe and the Balkans also did very well in the first wave, taking the advice on mask wearing as a means to protect the population, not necessarily the mask wearer. And that was the case in Czechia, Poland, Slovakia and Slovenia. But those countries actually were then part of a disastrous second wave. And they've since gone on to have a much higher mortality even than the UK, and that has been in part fueled by a slow rollout of vaccine. And there we can see those mortality rates. The figures really held up in terms of those COVID underdogs. They bought time by not waiting, not thinking their health systems could cope, and so they remain at the bottom of the list for the cumulative mortality per million. Finland and Norway are also in that group, Taiwan, and UK and United States, and now Poland and Belgium and Slovakia in a middle group, a levelling you can see in their mortality following vaccination programs, but you also see this rapid growth of mortality by in Czechia particularly, and that very much in a second wave phenomenon that caused that, the Delta and beta variants of the virus. So in terms of successes though, the COVID vaccine program has been an enormous success for international cooperation in the science world, in technology, the industrial chemists who were able to scale up production of vaccines, but we've also seen a downside to that more recently, which I'll come on to. And there you see it. The UK and Israel were very much at the start of the vaccination program, rolling out very early, but you see with the brown line for the UK that it levelled off much sooner than it should have, and staggered along with small increases from April to the present, and that largely because of the lack of success in vaccinating younger people, and something again which we need to address. Spain, Portugal and Iceland have shot to the top of the league table, and many European countries like France, Italy, Netherlands have overtaken us, and they're enjoying the peak benefit, I would say, of double vaccine with the mRNA vaccines, and we need to catch up with them. They're also benefiting from retaining the social measures, masking, social distancing, limiting of mass gatherings, and that may well protect them into the future as vaccine immunity wanes. So we've also seen many of us having to act in an era of the infodemic. We know about the misuse and misappropriation of data for distorting the results of elections, not just in Brexit, but also the Trump election, and in Kenya and other parts of the world. Mass information has been distorted to sway opinion and behaviours. But more closely, we know it in relation to vaccine hesitancy, and more sinister than merely the social media use of by anti-vaxxers. We know about the systematic spread of disinformation through the Russian troll farms, the content polluters, the agents that merely seek to seed disinformation, get people in a climate of fear and break their ability to think rationally. And that has backfired somewhat on Eastern Europe and Russia. The high areas of orange are the highest vaccine hesitancy in the world. There's also considerable hesitancy in France and in much of Western Africa and some states of the US. And these are in part due to religious and personal reasons. In some parts of the world, anything the state wants to offer you will be judged with suspicion. But we need to address that vaccine hesitancy, and we need to see social media companies addressing disinformation on their platforms. And this is the result of that disinformation. Much of Eastern Europe and Russia grossly underprotected in vaccination terms. The consequence of that disinformation has been this spread of anti-vax information, and this website I think is important. It's called Sorry Anti-Vaxxer. It's quite a respectful way of describing some of the consequences for people who have spread sentiment about anti-vaccination and have subsequently contracted COVID and died. It's not at all a website of Schadenfreude. It's a very important educational resource and a lesson from this pandemic that we must learn into the future. The era of disinformation has also been the era of populism and the era of distrust of professionals. And this cartoon that says these smug pilots have lost touch with regular passengers like us. Who thinks I should fly the plane? Well, that is very much a reality in populist governments. Look at the headline here: Boris battles experts to save Christmas. And Trump, of course, was the par excellence example of someone who knew better than his experts and disastrously killed people with disinfectant, amongst other things, and failed to act early in the pandemic. And we've also seen with populist governments that comforting lies are more satisfactory to them than are unpleasant truths. And that is the impact of the cumulative mortality for the US, for Hungary, for the UK, and relative to the rest of the world, a major impact through the behaviours of their governments. India is the only one that's below the world rate for COVID, and we don't know really how much the impact of that pandemic has been on India. Much underreporting likely to be the case there. So what did go well in the UK in the pandemic? Not a lot, if we're honest. I do believe the initial efforts by the Chancellor to bring in the social welfare, furlough, increasing universal credit, hotels for the homeless, these must have been very alien to the present Chancellor, but I think they helped certainly in the first wave. Most of the benefits or the things that went well were in the sphere of science and technology, and included the vaccine development, but also implementation of rapid trials of clinical interventions, and also the prospective clinical epidemiological surveys, including REACT and ZOE, and genomic sequencing of the virus, and the genomic surveillance that we now have in place, very valuable for us into the future. most of the things that are really important that happened, I would describe as not things that went well, but things that were necessary responses, and they were heroic, they were admirable, they still are. The NHS service response, social care has been unprotected and unsupported and continues to do a vital job, and local public health has also been undervalued, under-recognised and snubbed, despite Matt Hancock's claim that every local authority has a little Chris Whitty. There's still no investment in public health at local level. It's still a hollow sentiment and promise. Community responses have also been huge and selfless in the face of inactivity from national government, and we've seen mutual aid, volunteering, food delivery, and also in the vaccine programme, a lot of volunteering, meeting and greeting and so on. It's been absolutely vital to making these things work. National public health professional organisations, I think, have also done a very important job in the face of an uncaring and unresponsive government. We've seen these kinds of mutual aid programs going on in Asia and Brazil. The Dharavi slums of Mumbai mounted a huge effort and were very successful last year in preventing the spread of COVID and supporting people with food and shelter. And that similar enterprise has gone on in many parts of the UK, and some of those community mutual aid programmes are becoming more permanent solutions to long-term problems. We've seen it also in relation to the vaccination programmes, with faith groups, community groups supporting local public health to get vaccination rates up. And there are just two examples of how our professional bodies at national level have tried to make an impact on our government in terms of funding and also in terms of making the right policy moves. In terms of what went badly, virtually everything else, I would say. Political leadership has failed at all points. Procurement has been incompetent or in some cases corrupt. Test and trace has been very poor, and the Nightingale hospitals have been a solution in search of a problem. Care and protection of our children, taking them out of school when they needed to be in, or not taking them out when they needed to be out. We have failed to protect our children at home and in school, and we continue to do so. Neglect of local public health services, neglect of social care, and neglect of border control. We had no border policy until a year into the pandemic. And it's not me saying it, it's the Daily Telegraph. On every measure, Britain's response to the pandemic has been woeful. And that's the result. The 3 waves that we're seeing of COVID infection in the UK, way higher than Europe and the rest of the world, and with deaths now hitting 140,000, 160,000 if you count cause of death on the death certificate. So we've seen that we must not overlook this and forget about it for the future. There is negligence in what our government has done, and indeed potentially threats of corporate manslaughter at stake. We've seen at best incompetence in procurement, with stories of not fit for healthcare deliveries, and we've seen testing go badly wrong last year, with people being asked to go 300 miles for a test. But that, if we're generous, we call that incompetence. But this is corruption, and we shouldn't call it just cronyism. It's corruption, and it's companies, shell companies, people with no experience in PPE contracts, getting money from the government, from the taxpayer, and many beneficiaries of procurement who had no experience in what they were doing. We've also seen commercial protectionism and collusion in not publishing data on care home deaths. And we still see to this day failures of this government procurement, with the scandal over Immensa's failure to detect over 43,000 positive cases of COVID. And this is exemplifies what Angela Raffel described last year as the complete absence of quality control and the complete inexperience of some of the contractors to deliver these services. In the government's messaging, it's been contradictory. It's tried to appeal to the public sentiment, Magic Monday, the end of lockdown, and crystal clear that drunk people won't socially distance. We've had the let the bodies pile high allegations, and we've had the hypocrisy, the do as I say, not as I do, which again persists with the government's cabinet meetings, and the failure to wear masks, and the call from the Prime Minister for his MPs to stand cheek by jowl. And that climate of uncertainty that it creates only fuels anxiety, depression, a failure to act on the right things from the government, and it's all part of a very damaging picture that we've seen. It's also damaging that in the middle of the pandemic, the government chose to move to a new system and abolish Public Health England. Whatever you think of Public Health England, it was a daft time to decide to change it to something else. People looking after their desks, not their job, not their work. And there again is that quote from Hancock about how important DSPH are, but we're just not going to give you any money. This time last year, a number of medical authorities, the Academy for Medical Science, the SAGE Committee, and yours truly were saying that the government needed to plan for the winter, and almost, I called it Groundhog Day this year, almost the same reports, get ready for winter in July and August, and still very poor preparation, no intention to move off the plan A to plan B. All of the eggs are in the vaccination basket, and it seems incomprehensible to say in public that you think there could be 100,000 cases a day and still not see any need to act. So what needs to be done? I talk about planning for an outbreak of health. We need an equitable and coordinated global approach to COVID-19 vaccination. Here's an illustration of the complete inequality between low-income countries and high-income countries for access to vaccine. Less than 5% coverage in Africa and parts of South America. We need to address that because we won't defeat the virus unless everybody is protected. We just cede the opportunity for more new variants that will come round again, leading us to perpetual COVID. The initial promise of COVAX was an ambitious and a laudable one, with many countries pledging their support for it and their willingness to do something. But even to this present day, we've seen very little action, very limited donation of vaccines to COVAX for distribution across the world. And donation in itself is an inadequate way of providing vaccines to the world. When pharmaceutical companies tell us that they can't do new vaccines if they don't get enough profit, well, the reality is that most of the public money, most of the research money has been public money and there's no evidence that we will stop investing in new drugs and new technologies in the future. And this is a complete misrepresentation and a complete act of commercial protectionism. There's no place for that in a humanitarian crisis. There needs to be fair payment for drugs and vaccines, but we are seeing an act of commercial protectionism, and it has to go. We have to have a vaccine intellectual property waiver now, and we have to expand production of vaccines across the world. And it's also an act of colonialism to say that poorer parts of the world can't produce vaccines. India is the biggest vaccine producer in the world. So in terms of the outbreak of health, let's look at what we need to do in the public health system. My organisation, ASPHER, Schools of Public Health in the European region, we have a task force on COVID, and we've been producing a number of reports over the last 2 years. And if we look at how the public health system itself, we need more professionalism, we need more capacity, we need more investment in training and education, and we need to recognise the multidisciplinary nature of public health. We in the UK do that, I think, quite well, but you know, we need to engage people from as diverse backgrounds as international law, ecology, climate science, even political science, economics, and faith, and theologians. And we need that multidisciplinary public health. Our national leaders have called for better pandemic preparedness in the future, and there will be a special session of the World Health Assembly in November. And we need to see UN and WHO given more solid support, financial investment. We need better transparency in data sharing and surveillance, and we need new resources for each WHO region so that we can mount responses that can't be mounted by individual countries. These are the kinds of things that the independent panel chaired by Helen Clark and Johnson Sirleaf in May asked for, and my organisation is part of a global network for academic public health, and we are calling for renewed investment in schools of public health and in education and training, and also in professional development, professionalisation, recognition of public health for the skill and the discipline and the profession that it is. We are also calling for better public health. We need to recognise that the health of the public is everybody's business. One thing that the pandemic points us to is the need for global health and for addressing the major problems of economy, of wealth in disparities, and the destruction of the natural environment, which is bringing the human species into contact more with other species, and the opportunity for the spread of new pandemics. The Intergovernmental Panel on Biodiversity and Ecological Systems calls it the era of pandemics, and we need to address the economic pressures that are driving the destruction of natural environments on land and in the sea. The first wave of the pandemic gave us glimpses of what might be possible. This is two graphs of the decline of air pollution over China in the first wave with the close lockdown of Wuhan, and in many parts of the world have recognised the decline in air pollution with lockdown. The desire to move to more public transport, more walking and cycling, and cities fit to live in, I think is a genuine opportunity. And in the field of work and skills, our Prime Minister sought to expand the opportunities for young people that his previous governments had reduced. But there's also been experience in working practices and relationships. The ability to work at home could be good for the environment and for family relationships. And we've also really need to address the inequalities that have become so stark and unavoidable, unescapable in minorities, for vulnerable groups, for women and for older people. And Sir Michael Marmot produced his report, Build Back Fairer, in last year, and certainly we need to address those social welfare requirements that we're currently going the wrong way on. And this, the global inequality in income, is grotesque and obscene. The richest billionaires profited by $139 billion last year, and if they could cure many of the world's ills simply by going back to be as rich as they were in 2019. The inequality virus, Oxfam called it, and we need to see governments addressing that through wealth taxes. We also need to see this early experience of welfare developed. Many countries looking at citizen wage or a basic income, and we need to do much better on that. There have been innovations in housing, with empty offices turned to co-living, and shipping containers turned into housing, 3D printable housing. We can do better, and we should see a better future. And also in the field of renewable energies, as we go into a COP which looks unlikely to make much change to global climate change, and recognise that we are in a climate emergency. Nevertheless, there is an economic benefit to investing in renewable energy, and this 1 million climate jobs campaign is part of the case for that. So I say build back to what? To austerity, poverty, unfairness, environmental squalor, and health and wealth for some. We have to plan for an outbreak of health, and it's kind of reminiscent of what William Beveridge did in 1942 in the very deepest part of the Second World War, with no apparent prospect of an end to it. He produced a blueprint for the welfare state, in which he said that we should regard want, idleness, ignorance, squalor and disease as enemies of us all. That is the meaning of a social conscience, that we refuse to make a separate peace with evil. And I say, in the same way that they talked about planning for an outbreak of peace, we should say, well, let's plan for an outbreak of health. Thank you.